Let's engage the Kenya National Union of Medical Laboratory Officers Secretary General, that is Enock Wanyonyi, here on the program. And of course, as we take a look at the situation across the healthcare systems in the country. But first, before we do that, last week on Thursday, they issued a presser, and here is what they said. So let's hear what they expressed last week.
We recognize the medical laboratory officers who are in the front line in the war, especially in diagnosing the real patients. The union welcomes the government's intention to hire more health workers to help scale down the virus. By February 2020, Kenya Medical Laboratory Technicians and Technologists Board, KMLTTB, had registered over 15,000 medical laboratory officers. And amongst the 15,000, only 4,000 are in the public sector. This, therefore, translates to over 7,000 medical laboratory officers on standby and ready to help the government in this exercise. If we have to win this war, then laboratory diagnosis is salient.
Good morning, Enock. A lot to talk about, and that was a presser you issued on Thursday last week. I mean, we are talking about a country with, if we are to talk about the numbers of nurses in the country and the ratio of nurses to patients or doctors to patients, a concerning figure here because of the 21 selected facilities in the fight against the coronavirus pandemic, the number is not realistic in the sense if we are to mathematically battle the pandemic. What was the main issue of concern and why did you call for that presser?
Correct. When actually you look at this epidemic, look at it even worldwide, what is happening currently is that diagnosis made key, even in developed countries. Diagnosis is key because this is the only way you identify that the person you are handling is positive or not. So the only person who can tell you this is only the laboratory medical officer. Yeah. So the reason as to why we did this, as you can look at what we were saying on the press, the statement, is that KMLTB, which is a body that is supposed to register and regulate the medical laboratory staffs in Kenya, has registered over 15,000 at the moment. Only 4,000 are in the public sector. And this small number is what is now doing the diagnosis. We are relying on this number to do the diagnosis. And that's why we are saying that in Kenya today, 300 people are only supposed to be diagnosed in 24 hours. Is it possible that we can increase this number? If we have to win this war, then we have to do diagnosis. Diagnosis is a must. We cannot win war by curative. This virus cannot be treated. So the only way to bring it down is by diagnosing and identifying these people, quarantine them, isolate them from the real population. That is the only way. And that's why we went to press. We went to press such that we increase the number of diagnoses so that we isolate these people from the real population.
Okay, given that, why do you think then, or what do you think informs the decision by the government, for instance, because there appears to be the lack of collective endeavor here, since the county governments or administrations want the Public Service Commission not to recruit the planned 5,500 health workers. And equally, the Kenya medical doctors say there are more than 1,000 professionals who are qualified but are not employed. What do you think informs the government's decision to overlook you guys or the medical professionals in the country and go for other workers to support in the fight against the pandemic? Why is the government doing that?
I don't know, but earlier on, when CS Mutahi Kagwe came into office, I remember when he was being vetted, he said that I'm coming in to break the chain of cartels at the Afya House. So that informs you that actually there are cartels at the Afya House, and that is our perception. The cartels lie in Afya House, which control the ministry. Look here, for example, what PSC was advertising recently, the advertisements for jobs in the health sector recently. In medical laboratory, you find that the qualifications they were giving, they are not in line with the law. the KMLTTB Act.
Neither do they have the mandate because it belongs to the county government. It's health
Correct.
devolved.
Before even they reach there, the qualifications they were giving. Look, in that qualification, they give like civil engineers. A civil engineer doing laboratory diagnosis, soil lab tech. Look at that. So these are some of the qualifications. This informs you that these guys are misinformed. Whoever is doing that, we don't know. So we wish that the government do consultation. And I meant to believe that there is no consultation with the laboratory officers. Earlier on, last year, it was December, we issued another press over this issue. We said that this country needs to prioritize laboratory diagnosis. And we say that as it stands today, this country is not prepared to meet any new emerging disease. 1 month later, coronavirus was in Kenya.
Oh, and at the time, though, it was the peak of the disease in the city of Wuhan in Hubei province before Italy. In Lombardy in Italy became the hotbed of the coronavirus pandemic. But generally speaking, again, you still are within the medical profession, and there seems to be deficiency in equipment and trained ICU workers in the country. We're talking about 518 ICU beds with ventilators in the country. 87% of that is occupied. We have 142 cases. Mathematically, if this is to exponentially grow, can we withstand that?
Well, what is important here, like if you got me earlier first, the issue is diagnosis should be key. Because I told you that this disease is not curative. Like any virus, you cannot cure this disease. There's no, even if we bring these people on treatment, what are we treating? Because unless we do diagnosis, you know, you can put somebody even under a tree and do the treatment. Ask doctors will tell you that. Ask clinicians will tell you that. They can treat somebody even under a tree. So if we don't prioritize our objectives here, and the objectives here is laboratory diagnosis, we have to identify these real people before we do the curative.
All right, and that again brings to forth the aspect of now the people who work in the laboratory who are at the epicenter of establishing the causes and afterwards again give go-ahead for medical treatment, because without the laboratory then we have nothing. It's basically the fulcrum, it's basically the fulcrum point. So you talk about then unemployed laboratory workers in the country, the government overlooking that again. My question again, as was the case earlier, why do you think the government is doing that even in the midst of the calamity and the navigation of the dirty waters of the coronavirus pandemic?
I don't know. That is the question I should also pose.
Did you reach out to key stakeholders in the ministry?
We've written to them.
What was the response?
We've written to them, and normally there are no responses. Earlier on, the person who was in the health docket, the Cecily Kariuki, wasn't even responding to anything. So I meant to believe that the new broom in the office, maybe Mutai Kagwe, may listen to us, as from the indications we've seen from him. So maybe with him, we shall reach where we want to go. But we've told them that these numbers cannot consummate to the needs of Kenyans. Okay. It can't.
In that particular regard, in seeking your judgment with regards to now the government and where we seem to be having a shortage of laboratory workers in the country, who of course are qualified and know the know-how or how to go about the business of what happens in the laboratory, then in your judgment, in seeking your judgment, do you think that the government is failing even in the midst of this pandemic? Correct.
It is. It is failing. Look, for example, in Wuhan, China, what happened? When the this pandemic came up, what was the first thing to do? They increased the laboratory diagnosis. In US today, diagnosis is key, not curative. They increased the diagnosis. Laboratory diagnosis is very key. Today, if we talk of this diagnosis of these people, why is it that the government is doing 300 people a day? Why is it that people are still hanging in quarantine, waiting for diagnosis, waiting for resource?
Does it perhaps again explain the need for more measures to clean up the health ministry, because it appears to be equally docked by allegations of corruption? For instance, talking about the 2015-16 financial year, where the taxpayers have lost more than 5 billion Kenya shillings.
Correct.
So
there is a problem.
I mean, as stakeholders then, not only you as the medical laboratory officers, there are equally concerns from other health workers in the country who feel that the government appears to be under-acknowledging them, unemployed health workers in the country. We did that in the midst of course, 2018, just after the handshake, when we imported Cuban doctors from Cuba after President Kenyatta's visit to Havana in Cuba and met Fidel Castro, then leader. And then this aspect comes with regards to, again, another double tragedy sentence where the county governments are fighting the national government. Why do you think we are lacking the consensus here in regard to fighting from a common front and the sense of a common upfront battle against the pandemic from your end, from the county governments and from the national government's end?
I'll tell you this. I think it starts from the word go, the 2010 Constitution. Health, when you look at health, actually, like security is, health is not a function that was supposed to be devolved. This is one of very vital services that the government has to offer. This was a mistake in the first place. But now we are now in 2010 Constitution. We have to accept the Constitution. But health was not supposed to be developed as a function. When you look at what counties are doing now, it is very clear the counties are unable to run the health system.
Are they unable, or is there the inability, incapacity?
They are unable.
Isn't it a case of incapacitating the existing capacity? Because the resources are there. Yes. The equipment are there.
Correct.
But we have failure in not even allocating good capacities of healthcare facilities across the counties.
Well, whatever the case could be, even the resources are available. But look here, these guys cannot run counties. Look at the human resource itself, how they are managing the human resources. It is not proper. How they are doing it is not proper. Look at, for example, Kisumu County.
All right.
What is happening in Kisumu County gives you a clear indication that these guys cannot run this thing.
All right.
The same applies in Kirinyaga.
Okay, well noted point, because for Kirinyaga it's a case of perhaps more or less an intense case, but we'll come and generally talk about, of course, why hospitals lack trained ICU workers in the country, according to a survey released by the Daily Nation, and equally the concerns raised by the Council of Governors, with, of course, by its chairperson, locally for Paranya, Kakamega County, and of course from your end we'll be equally hearing the other soundbites that you had on Thursday last week, and this is of course some of the other issues that you wanted the government to address.
The government decentralized the testing of the virus across the country. That in all level 4 hospitals be equipped to perform the tests. Each county to hire at least 100 medical laboratory officers in order to intensify random testing of Kenyans. We also recommend that there should be protection of health workers during this exercise. Provision of personal protective equipments, PPE, is supposed to be enhanced. Masks, gowns and gloves, amongst others, should be made available. Proper identification is required to healthcare workers at this time of curfew to avoid police harassment.
Healthcare workers are dying and are being affected. So I urge the government to make sure that each and every healthcare worker is provided with quality and adequate PPEs.
It will be more helpful and quicker and easier to identify these patients and be able to isolate and get them well settled and reduce the numbers of spread. As we can see, we get samples coming all the way from Western, from Mombasa, to come to Nairobi for testing. If we can get them distributed everywhere, it will be easy for us to get to know how to settle and so help them. Having the PPEs is one of the most crucial and important things.
SG Wanyonyi, you talked about in that press again, the aspect of hiring at least 100 workers for all the counties.
Yes.
And that, of course, comes up to roughly about 4,700 workers who are unemployed in this particular regard.
Yes.
So talking of that, and you talked about the level 4 hospitals, but of the 21 selected facilities in the country, the Moi Teaching Referral Hospital, Kenyatta National Hospital, 5 level 5 hospitals, 3 mission hospitals, 11 private hospitals. The ratio is that at the Moi Teaching Referral Hospital, 1 nurse to 2 patients. The missions, 1 nurse to 2 patients. Private, 1 to 1. And level 5, 1 to 3. Even in the fight against the pandemic, can this not lead to a burnout and affect the quality of our nursing care?
Correct. I do not speak on behalf of nurses, but I'll tell you exactly that the problems that nurses are facing, together as leaders of nurses, doctors, and even clinicians, we've been sitting together over these issues. There is a problem in understaffing that's affecting the country. As an individual, if you ask me, I don't know the reason as to why Kenya went to Cuba to hire doctors, yet we have unemployed doctors inside the country. What was the reason behind that? Today, according to WHO, 1 doctor is supposed to man around 1,000 people. So in Kenya, for example, what is the population?
47 million.
47 million. Then that one translates to what? 47 doctors should be employed. Are you getting what I'm saying? Yes. Now, WHO again says, if 1 doctor is manning 1,000 people, then it translates that 4 doctors should have 1 laboratory technologist behind him. So that one can give you the calculation. You take 47, divide by 4, it gives you the number. But today, what do we have? We have only 4,000 laboratory officers in the country. Can that one translate to the population's need?
Of course not. And I'm talking about that because we equally have 518 beds equipped, of course, ICU with ventilators against a population of 46 million Kenyans, already 87% of that occupied. We earlier mentioned that. But the main important point here is you also equally talked about the concerns you have.
Correct.
For healthcare workers who are at the forefront or at the front line of the fight, in the fight against the pandemic, do you think that they are adequately well facilitated by the government in this fight? Because they are the ones, of course, who are the link between the patients who are, of course, tested, either test positive or negative, and then the government which relays the information to the Kenyan public.
Correct.
Are they facilitated enough, and are they getting enough attention from the government?
This is it. The facilitation in this place means, 1, you have to train them. Coronavirus is a new virus. None of us was aware of this. Even in the place it originates from, none of us knew about coronavirus. So therefore, there is need for people to be trained. The health workers need to be trained. Are we training these guys? No. We saw some training that was being done, which was done haphazardly. Some guys just hijacking the process, training people of their own interest. So this is one of the key issues. Training is a must. Because this person, you are taking this person to the field, is he aware of the virus is going to handle? He's not aware of that. That is one of the key issues. Training is a must. 2, you have to provide personal protective equipment or gears. I think you've displayed them on the PPE. Is a must. Because this person is going to be exposed to the virus. Look here, when we are taking soldiers in Linda Inchi.
Of course, you have to keep them with the state-of-the-art military machinery.
Correct. This is another war. In fact, this is a biological war that we are entering in. And the soldiers must be protected at whatever cost if we have to win this war. Are we providing this PPE?
Given that, and of course, General, when you express the point about healthcare workers, it's a case of an all-encompassing mechanism here, where you have one umbrella that's covering the entire health docket or health professionals in the country.
Correct.
Now, we are, of course, fighting this particular pandemic for the Kenyan populace to be safe, and that's a responsibility the government has, because given by the people, they need to protect the people, and this, of course, includes or comes under that mandate or authority. But only 11% of hospitals in the country have ICU beds and capacity.
That notwithstanding, I told you earlier on, ICU is a provision that needs to be done in every hospital. But at the moment, it's not a necessity. People can be treated, as I said earlier on, can be treated even under a tree. Do you know the reason as to why the CS was saying that the counties should prepare a place whereby they will have to isolate these patients and even do the treatment? They were even proposing schools, boarding schools. True or false?
But the concern is...
They were even proposing
how that...
today,
How that was done is the question by the counties here in regard to whether they are doing it out of perhaps showing for the sake, or whether there is that deep sense of responsibility in ensuring that they provide facilities that at least can cater for the needs of the people, because we are having concerns of Kenyans who are quarantined across institutions in the capital Nairobi, but equally there are no basic needs and facilities. So how do we do that?
Well, like I said, this is something that the government missed some time back, all along. The issue of ICU, this is something that the government missed. All along we've been singing about UHC. All along there has been budgetary allocation. I'll take you back to what we call the Abuja Declaration. The Abuja Declaration was that every county, developing country, should set aside at least 15% of its budgetary allocation to health. Is Kenya doing that? At the moment, we have allocation of 7%. The reason as to why we are not meeting these measures, the reason as to why we are not having ICU machines in these hospitals, because our budgetary allocation is under the belt. The belt.
Okay.
Yeah.
Well noted point. And we'll come to the county aspect and why the government or the Kenyatta National Hospital is having registrars and who are postgraduate students from the University of Nairobi, numbering up to 400, is still in their rota. And when even universities across the country have been shut or closed following the first case of the coronavirus pandemic in the country in March last month, and why the hospital is doing that. And then from the county end, is still take a look at the preparedness level and whether we'll see how the devolved function appears to be a case of concern, and of course perhaps the point of contention between the national and the county governments in the country. The number is 0791478990. The hashtag on Twitter is NewDayKE. The short SMS code is 40920. After the break, we'll be coming back and finish up with the discussion with the Secretary General of the Kenya National Union of Medical Laboratory Officers in the country, Enock Wanyonyi. Welcome back. Now, as a way of enhancing an enabling safe environment in the battle against the coronavirus pandemic in the country, the government is looking into many aspects of course, ways to curb the coronavirus pandemic in prisons. Now, the Faraja Foundation, in partnership with the Kenya Prisons Department, donated toiletries meant to benefit inmates. Led by the Foundation Chief Executive Officer Jen Kuria, the donations are aimed at assisting prisoners during these difficult moments as the country battles the pandemic occasioned by, of course, the coronavirus, which led to the imposition of the dusk to dawn curfew by the government. Now, addressing the media after the distribution, the Prisons Commissioner General, Wycliffe Ogalo, applauded the move, saying it will boost efficiency at all prisons across the country.
Today we are here to flag off a support with sanitary toiletries, because basically the lockdown has made it impossible for us to go to the prisons that we work with and to be able to support. And because of wanting to observe sanitation, we are providing soap today. Next week we shall provide toilet papers and other items that are required. This is because the Commissioner General requested us to be able to support in this, so that the inmates, even the officers that are in the stations, can be able to observe sanitation. We have done many other, in partnership with Prison Service, we have done very many other projects, but this is what is important.
What we would like to urge Kenyans is that we listen to what the government is telling us through the Ministry of Health, and let's listen so that we can minimize the adverse effects of COVID-19.
As I say that, I also want to acknowledge the very fact that we have walked the journey of partnership with Faraja from 1999. But this is a landmark because Faraja has teamed up with Kenya Prison Services to ensure that we enable our inmates to observe the basic hygiene during this trying moment of COVID-19. While saying that, I want it to be, I want it to come out clearly that the onslaught against COVID-19 cannot be singularly fought. it requires a multi-sectoral approach, both state and non-state. And that's why Faraja has responded to our request.
Kilifi County Deputy Governor Gideon Saburi has been denied police bond. Of course, this follows his arrest after he was confirmed and tested positive for the coronavirus pandemic after returning to the country from Europe, one of the epicenters of the coronavirus pandemic in the world. He's set to face charges of course, denying self-quarantine, which was made mandatory by the government following the confirmation of the first case by the government in March 2020.
A contingent of about 20 DCI officers in at least 4 cars was at hand to arrest the DG on Friday. Saburi had kept the detectives waiting at the hospital for about 5 hours. According to his lawyer, Otiende Amolo, who tried to secure Saburi's release on a police bond, says he could not understand why his client is being denied police bond. Saburi is likely to be charged in court on Monday for refusing to self-quarantine upon arrival from an official trip to Germany on March 6th. Health CS Mutahi Kagwe said the government would use Saburi as an example for those who refuse to adhere to the anti-coronavirus measures issued by the government to try and check the spread of COVID-19.
He has been declared fit after being subjected to 3 tests, all of which have turned negative. Naturally, the issue of the law will now follow up with him.
The CS maintains that to halt the spread of the virus, people should heed to the directives, including self-quarantine, terming those who refuse to do so as selfish.
I do not wish to scare you, but with the figures I have just read to you, there is no gainsaying that this is a very serious threat to our lives and to our nation.
On Saturday, leaders from Rabai defended Saburi, saying he has already suffered enough punishment. Philip Mbaji, a vocal opinion leader in Rabai, said the DG has suffered enough psychological torture and trauma. Saburi is facing a fine of up to 30,000 shillings or a jail term of not more than 3 years. Kenya has so far recorded 142 cases, 4 deaths and 4 recoveries. Winnie Lubembe for Ebru TV.
Now, there was a time when starting up a business of any kind required an immense amount of market research and some physical office space to meet the potential clients. But the days of big office may be coming to an end. It's called the co-working and co-working place in Pakistan's designated to help women entrepreneurs. The Voice of America partner station's Getiara explains from the capital, Islamabad.
Sara Ali is developing an IT platform to improve communication between citizens and the government. While her IT startup isn't big enough to invest in office space, it isn't small enough to run from home either. So she has chosen a co-working space or an office work share in Islamabad called We Create.
I think this is a great place and also a cost-effective way. Because obviously when you are trying to build your startup business, you have to work with your budget.
We Create opened its doors in 2014, and along with internet, offices, and conference rooms, it also provides entrepreneurial trainings and counseling.
Creating an office space is a big hassle for women in Pakistan. They usually face so many operational hassles that it takes their focus away from business development and into operational management. So we created an all-inclusive facility to help them.
Some entrepreneurs, such as Andalib John, travel from remote areas to take advantage of We Create's seminars and trainings.
We learned how to turn an idea into a business, how to value our ideas in marketplace, and how we can benefit from it. I really need a training on how to pitch my ideas as well.
In a conservative country like Pakistan, millions of women dream of owning their own businesses. So far, more than 30 women have launched their businesses operating from We Create, challenging a highly male-dominated workforce. For Gaiti Ara Anis in Islamabad, Pakistan, Bejan Hamdard, VOA News.
Thank you for that update from the capital, Islamabad. And of course, Prime Minister Imran Khan will be looking at perhaps ways of trying to curb issues that affect workers in his country. Coming to you, Wanyonyi. There has been the aspect we talked about before we went on break about the more than 400, that is registrars at the Kenyatta National Hospital who are postgraduate students at the University of Nairobi. Why will the hospital, the Kenyatta National Hospital, put 400 students at the forefront of doing tests when the universities have been shut and put them at the risk of getting infected? Or catching up the infection?
That is a question that I will also ask you, because as an individual, I don't know the reason as to why a government should go for trainees, yeah? Yet we have qualified doctors. And the doctors or health workers have been asking the same question. Why are you not employing us? We have an influx of health workers who are unemployed. Mm-hmm. Why is it impossible for the government to employ these people? Why is it impossible for them to be hired? Why should it go for students? You know, this is what we call cheap labor. And I know it is exposing these students on the risk. You know, majority of them are not qualified. And it is even within the law that a person who practices should be registered and having qualified. Now, these people can only practice under instruction. They can only work under instruction. Mm-hmm. Who will be instructing them? The other health workers who should be instructing them, they are also overwhelmed by the risk. So this one now translates to these students being at high risk of infection than even doing a good harm.
And I just want to quote a senior doctor at the Kenyatta National Hospital here, Dr. Alfred Odhiambo Otieno, who said, I quote him, "We formed a group to buy protective gears." I mean, why do you think then that even in the middle of this fight or battle against the pandemic, the government appears to be falling short of providing even the needed equipment to medical professionals, especially in a facility like the Kenyatta National Hospital, which is the biggest in the country?
Yes. Like I told you earlier on, I told you about the Abuja declaration of 15% budget allocation, but we've been allocating money, or our budget allocation is actually 7%.
Meaning we are less by 8%.
Correct. Mm-hmm. Why is it that way? Why is it that other countries have done so? In Africa, the only country that has made the Abuja declaration is only Rwanda. Why is it that Kenya cannot move to this percentage? Even if it moves to 12%, why is it difficult? Why is it that other things which are not very important to us, like now international travels, we've seen MCAs going to other countries in the name of benchmarking. Why should we have those things actually in place? Why should people spend the whole of the term, 5 years, still benchmarking? Last year, or this year, before the outbreak of coronavirus, there were a number of MCAs who are scheduled to go to US for benchmarking. Why? And the money that was supposed to be scheduled for these guys to go for benchmarking, why is it not being translated or transferred to health now? Because this is now a necessity. It is a risk. It is a warfare we are in. Why is it that money cannot be transferred to health at the moment?
Given that, and you mentioned the Abuja Declaration, and of course, among the whole host of other global sort of gluing conventions and laws that are ratified by member countries.
Yes.
But policy decisions are largely equally political decisions in the country, isn't it, or elsewhere?
Correct.
Then does it mean that there is the lack here of the goodwill politically from the government in ensuring that such declarations are implemented? And why do you think the government lacks that appetite?
As an individual, like I told you earlier on.
Of course, as a health professional.
Yes.
Why do you think there is that lacking of the appetite by the government?
We've been pushing for these things. We cannot exactly understand why the government doesn't implement this Abuja Declaration. Why is this small country like Rwanda implement this Abuja Declaration? Why is it that Tanzania is moving closer to that? Why is it not Kenya? As you said, the political will is what is affecting this country. And perhaps the people the government has been placing in this health docket as the CS are the wrong people.
Including Sicily, Mr. Mailu.
I'm telling you.
All failed?
All these things, you've seen what has been happening in that ministry. All along, when Mailu was in the ministry, you saw what Cecily Kariuki did when she was in the ministry. What has been being reported from those ministries is only corruption after corruption. When Mailu was there, you heard what was there. When Cecily was there recently, you heard what was happening. The NHIF scandal, the medical equipment scandal. You've seen it just the other day. and which has not been completed.
And we have not seen any prosecution of a senior ranking official at the Ministry of Health, despite having investigations conducted by of course, agencies in other ministries in the country. Who do you think is shielding all these corrupt officials at the ministry?
That is the question. Why is it some individuals in this
country? Who do you think is shielding them then?
I can't tell, because I don't work in the system, the government system. So I don't understand. Because, for example, the medical equipment scandal has never been investigated by the government. I remember the DCI has been very proactive in investigating other scandals, and I've never seen it investigating the health scandals.
I mean, there's some sense of immunity for the corrupt officials. Mr. Muraguri, the former principal secretary, is now scot-free, despite, of course, using 120 million to get a palatial home somewhere in his rural home.
Yes.
And Cecily Kariuki, while she was at the helm, there were equally chains of corruption allegations in the ministry.
Yes.
It's a case of perhaps the untouchable, isn't it? And a government shielding corrupt officials.
I will call it that way.
Why will the government do that then? Because you want universal healthcare coverage, you want Kenyans to be covered, you want a flattened curve for access and affordability of healthcare in the country, yet the same docket that all these things fall under appears to be ravaged and corroded by corruption.
I tell you, if President Kenyatta is listening, this UHC will remain just a fallacy unless the health system is revamped and the priorities are set. The health workers need to be brought on the table. These guys know where the shoe pinches. They understand the right keys to press. I don't know, whoever advises him on matters of health, if actually UHC is one of the agenda that he needs to achieve, then he needs to listen. He needs to sit down these health workers and listen to them.
In your view, is he listening?
Let me assume so.
Misadvised?
Of course, that is what I can say.
Okay. There are many occasions that the government and the health professionals in the country came, of course, to loggerheads.
Yeah.
At some point, of course, it was all about the collective bargaining agreement.
Correct.
And what the health workers were calling for was better pay, better infrastructure, and good working conditions.
Yes.
That was never achieved until the doctors were even detained for seeking that at the expense of Kenyans because they wanted the better for the Kenyan people.
Yeah.
After the dust settles and we shake off the coronavirus pandemic, do you think then that the government will perhaps develop some sense and think about bettering the lives of the healthcare professionals in the country and boosting our healthcare system?
As an individual, I think this is a learning lesson for Kenya. God forbid, but it is a learning lesson for Kenya. Perhaps to review its strategies on health as a system. It is a learning lesson. Actually, all these things that we've been telling them, you know, you cannot talk of healthcare system without the healthcare workers. Who is healthcare? It is the workers. The healthcare workers are the ones that form the healthcare system, not the infrastructure, not the buildings, not the machines. It is the manpower that makes the system.
With this strategy adopted by the government in regard to the fight against the pandemic or the battle against the coronavirus pandemic, is it realistic and do you see light at the end of the tunnel?
I'm a bit skeptical on the approach the government is taking. Even though C.S. Kagwe seems to have a grip on the ministry. He has the inertia, he has the stamina to handle this pandemic. But as I look at it, perhaps there are some people who are misinforming him, especially in the hiring of these staffs. Something needs to be done urgently.
All right. Now, as we finish up, there's also the important element of the county governments here in regard to their opposition to the hiring of medics in the fight against the pandemic in the country.
Correct.
But the concern is that the county governments have not been doing enough on their front, despite some aspects of jeopardization and micromanagement of the health affairs by the national government in Nairobi. And on their front, equally, there is a failure, isn't it? And how do we intertwine efforts by both the county administrations and the national government to develop a mosaic of a common approach to the fight against the pandemic?
Like I told you earlier, the greatest problem, like I told you, was the 2010 Constitution. Health was not supposed to be devolved.
In your view, it ought not to have been devolved?
It wasn't.
Why do you think that?
Even the national government has failed so.
Why do you think that?
This was a very vital services not to be developed.
Is it
like
because
security is?
Okay, is it because of the infrastructure the national government has under its arms, or
mismanagement.
Mismanagement.
Correct.
At the county front.
Yes.
But you cannot rule out the fact that equally, while it is devolved and it's law that we need to adhere to the constitution, that the national government has been equally micromanaging the affairs of the health system in the country.
I do accept.
So where is the point of combination then here, the point of convergence here for common approach?
I do accept that. The reasons why we've been saying this has led to something called HSC. We as union leaders sat down and tried to find a solution to this problem. And the solution was to form one center of managing the healthcare workers, which was Health Service Commission, as teachers are. In that, we leave these guys, the governors, to manage the infrastructure. Yeah? Let one center manage the healthcare workers so that we have uniformity. What is happening today at the counties is actually pure nepotism and tribalism, in fact, in hiring the staffs. You are only related to the governor, that's why you are given job.
Or members of the county.
Yes, that is what usually is happening. And no, these guys, before even they allocate the budget on hiring of staffs, is usually political. And that's why I'm saying this thing needs to be taken to the central place for it to be governed. National government must run the health system.
And even as you point out that, the problem is that the national government is not immune from corruption.
It is not.
It's a case of vis-a-vis, I mean, the national and
Yes,
the county government.
yes.
But you can't imagine the embezzlement of more than 5 billion shillings at the Ministry of Health.
Correct.
Say it's under the of course, mandate of the national government. How do you still immune and tighten the tap or the taps of corruption, because they are equally pilferage. There is equally pilferage of resources at the national level.
Yes, Aib, look here. It's better we have one hyena that we know, and we can easily face that one hyena, than have 47 hyenas on our table.
So in your view, it needs to be taken back from the county administration?
Correct. Because what is happening even in counties is pure corruption. So this is decentralization of corruption. So in my view, we better have one center of corruption at the national level than have 47 of them.
All right. And this is what the Weekly for Paranya statement did say last week towards the, of course, the hiring or the planned hiring by the national governments of medics in the fight against the pandemic. Yeah. He said the county administrations note with utmost concern that the Public Service Commission is advertising positions on behalf of the county governments. Kindly note that this will not work, since the function of hiring staff is a preserve of the county public service boards, and the statement ends. However, the concern is that counties like Kirinyaga have no county service board.
Correct.
And what that reveals is the absence.
Same applies to Mombasa.
Okay, absence and the lack of a collective endeavor even in the fight against the pandemic. Where is our point of convergence again? Because there seems to be disparities and continuous growing of the gap and misunderstanding between Nairobi and the 47 county assemblies.
Yes. I agree with what Oparanya says. Why? It is within the statutes that the only person who has to hire health staffs at the counties is county service boards. That is within the law, the 2010 Constitution. So the fact that we have a pandemic does not erode the Constitution. So Oparanya is very right. And this is a problem that I said, this is a mistake that we made. At the moment, we just have to swallow the bullet.
In your view, is it right for the Public Service Commission then to hire the staff?
Public Service Commission serves no mandate to hire staffs.
Where is the point of consultation then here? To consult the county administrations? I mean, if it does or goes ahead with hiring, then that is unconstitutional and illegal in that particular regard.
Correct.
Then where's the point of consultation to just for the purposes of defeating this virus and setting up things to normalcy?
Yes. If at all these guys, like I said earlier, if at all the government listened to us earlier on, then health system would have even moved to a central place. We've been pushing these things even through parliamentary select committees on health to have the bill return this mandate to a central place. Then this thing would have been handled earlier on as now. But now they refuse to. Today, this issue is with us. I think at the moment what they can do is having consultation in between the counties and the national government.
All right, which is important and very paramount in regard to what's transpiring in the country.
Correct.
And you also talked about in that press you issued on Thursday last week of a lockdown.
Yes.
And 68% of Kenyans now are in support of that.
Yeah.
And the concern is that 70% of those Kenyans who support the lockdown are not prepared for it or the consequences that might come in the aftermath.
Of course, they will never
So we'll talk about that. So let's hear what you had to say about the lockdown and come back and discuss about that with regards to, of course, the other guest who is set to join us here on the broadcast.
Asante.
Lockdowns come before because people are not doing what they are supposed to do.
Ile shida iko hapa, hatuwezi kaa tunatafuta. Ukikaa unmite inabidi tu mnakaribiana juu unatafuta.
Unajua saa hii tunafanya biashara. Sasa tunajaribu vile tunaweza ku keep your distance, lakini by the time tunapata tu tushakuja pamoja tu business tunafanya.
They are crying out, put lockdown. Yet the accounts read millions of money. What about mwananchi wa kawaida? We have got nothing in our accounts. Even some of us doesn't have account.
Juu mimi hata nikiwekwa kwa nyumba leo niambiwe nisitoke, sitakuwa na pesa ya kesho. Pesa ni ya hiyo siku tu yenye nimepata. Kwa sasa hivi naongea hivi kwa mfuko nina mbao. Nimekuwa na 70, nimekura 50. Hata jioni sijui kama nitafanya kazi nyingine.
President is true. Is a true leader. Either akaanza mambo ya curfew ama aondoe polisi tujiprotect corona. Kwa sababu polisi ni problem more than curfew.
Tafadhali tusiwe tumesituliwa na corona, tunasituliwa na risasi, live bullets. Sasa sisi tutakaa namna gani?
This is the right time to come the lockdown, but not whole country. To the high risk, prevalent, already prevailed and prevalent places, locations like Nairobi, Mombasa, Kilifi and so on and so forth. But complete lockdown to the country is not alarming, but we need lockdown and we don't want the counties where these things prevailing not to spill over to other counties. Today in our constituency cases, we have around 12,000 elderly people, abos and kogos, and also very needy people.
All right, we are still continuing to cover the coronavirus pandemic in the country. And before we introduce our other guest here on the program, this is what the Daily Nation this morning had to say. Charles, if you can have this up in regards to the lockdown that many Kenyans are supporting at the moment. And you can see Kenyans proposing for a total lockdown in the country as regards the coronavirus pandemic and the concerns raised by many Kenyans as to the effect or the consequences it can come with or that can accompany a full lockdown or a total shutdown of the country. We are joined by Claudette Alusa, who is the Treasury of the Kenya National Union of Medical Laboratory Officers in the country, the same organization as the Secretary General Enock Wanyonyi here in the country. Good afternoon. I appreciate your time. Thanks for coming. Well, we are on the point. We'll continue. Of course, I'll come to you with Wanyonyi in regard to what we've been talking about, the capacity of the county governments and whether they can withstand the test of time and the coronavirus pandemic test in the country. You talked about the aspect of the counties not having the muscle to withstand that, and the, of course, sort of a deep skepticism that you have in regard to whether they can handle this pandemic, though there are no cases reported outside Nairobi County, except for the cases of Kilifi and Mombasa counties. What's then the point of having resources devolved at the counties when the resources are mismanaged and the same administrations across the 47 counties are complaining about the national government in not supporting the county administrations?
Well, like I told you earlier on, we better have one hyena, one thief we can control than having 47 of them.
That doesn't mean you support corruption, isn't it?
Yes, I do not.
Meaning you acknowledge there's corruption at the national level.
Let's have one person who is accountable, we can face, than having 47 who are not accountable. So if we have one central person, we can easily handle that person as an individual who is supposed to be accountable. Then having 47 of them is difficult at the moment. Like you said, you gave me an example that Kenya County doesn't have public service board at the moment. So how will that hiring be done? The same applies to Mombasa. Who is managing the staffs at the moment? Because the employer here, legally, is supposed to be Public Service Board.
Of the county.
Of the counties. Now, who is managing the staffs in those counties? There is a lacuna. So this one actually translates to having one central organ managing the health system or managing the health workers. And that's why we proposed the HSC, Health Service Commission.
Which is equally captured in the Building Bridges Initiative.
Correct.
I mean, much weighted.
Correct.
Claudette, if I may come to you. In regard to what's transpiring at the moment, where there appears to be the lack of coordination between the counties and the national government in the country, do you think that there is going to be a collective winner in this case, and the administrations both at the county and at the national level emerging as the victor in the fight against the pandemic?
First of all, the fact that we need to sort the pandemic results to us having the unity and the coordination between the county level and the national level. If you don't get to have a sit down and for the two and find a good solution on how to carry out things from the national down, trickling down to the county level, then we will not be able to sort these things out. But if we get to have that understanding, at the national level, this is what people are doing. At the county level, this is what we need to do. That way we can be able to break it down so that every person knows this is what I need to do and this is how I'm going to fight this pandemic, and that way we will win. But if we don't have that form of unity right now that is needed, we will not be able to conquer this COVID.
All right. Now, also the other important element that we need to, in this particular regard, talk about is the aspect of lockdown that many Kenyans are calling for, and that is in regard to the papers as we have shown on the screens of our viewers back at home. And more than 68% of Kenyans now are calling for total lockdown. However, what's interesting is that 70% of them are not prepared, or 7 out of 10 of them are not prepared for the consequences in the aftermath of the lockdown. Are we going that way, and do you think we have an exit strategy in the fight against the coronavirus pandemic?
Ayub, you look at what is happening globally. Most of these countries have done what we call lockdown, including the developed countries. US, Italy, Spain, name them. They have done lockdown. Look at Africa. Rwanda is doing lockdown. Our neighboring Uganda, which has registered a few number of tested positive cases, is doing lockdown. Why not Kenya with 143? You know, the issue of preparedness, I'm telling you, will never come. Even if we reach 10,000, a number of Kenyans will say lockdown is not the best way to go. So in such matters today, this is a warfare. Yeah? And in our war, sometimes we may not reason with the people because we have to take measures to safeguard the other individuals, the other population, the larger population. And the decision here is to have a lockdown to safeguard the country. We may not listen to some of these issues, some of these proposals from Kenyans. But at the end of the day, after saving Kenyans, most of them will come to us and say, you did the right thing. At the moment. But that is the only measure we can
But the government has to address other aspects of the economy, isn't it, before a lockdown? And you have mentioned countries like the United States of America, where the Donald Trump administration pumped or injected $2 trillion in a $23 trillion economy, which is the United States. In the UK, you had the Chancellor who issued a press alongside the Prime Minister Boris Johnson before he was infected. And the government standing for 80% of the wage bill of the country, numbering to about £2,500 for each national in the UK. You talk about Germany, which is a welfare state, social welfare state, as is the case with Italy and Spain. So how do we gauge the economy before we go for a lockdown? Because the consequences economically are going to be huge.
I'm meant to believe that that is actually one of the key issues that we have to face. However, the issue here is life. Now,
but what about hunger?
I am aware of that.
80% of our economy.
I am aware of that.
Okay. What happens to the common Mwananchi who lives for the day, 100 shillings, which is at $1 a day, who goes buys paraffin and then he is sorted for the day? What happens to him? And they form a large bulk of the Kenyan labor.
Look here, I'll give you a question. For example, it's almost 2 weeks or 1 week so since the government declared a curfew. Dusk to dawn curfew. What is it helping? Are we seeing the results? out of the curfew. The number of tested positives are escalating each day. So is it serving any purpose? It is time we move to another strategy. And the strategy here is lockdown.
Okay.
How prepared this will be economically is the country. We have the leadership in place. It has to find a solution.
All right. Okay, we'll come to that. And equally, we'll be joined by the other guests here on set as to finish up with the last segment of the program here on New Day mid-morning show here on the broadcast as we discuss aspects in regards to the coronavirus pandemic, the consequences from the health, of course, perspective, and a lockdown that many Kenyans, by 68%, are supporting or calling for from the government. And we'll continue with the discussion after the break here on New Day. The number is 0791478990. The hashtag on Twitter is NewDayKE. The short SMS code is 40920. Stay tuned after the break. Welcome back on to the last bit of the discussion here on the broadcast in regard to the coronavirus pandemic in the country, the measures the government is putting in place, whether there is an exit strategy, what it's doing to help the healthcare practitioners in the country, the concerns raised by, of course, professionals in the country, among them the Kenya National Union of Medical Laboratory Officers, whose members are on board here on the broadcast. And I'm joined by Ann Sakwa, who is a member of the Kenya National Union of Medical Laboratory Officers in the country, alongside Claudette and the Secretary General Enock Wanyonyi. And I was on you before we went on break, Bona Secretary General, in regard to, of course, the concerns that are raised by many Kenyans as regards the lockdown that is a common practice now, more or less, across many parts of the world, largely across the 183 countries or regions affected by the pandemic. But do you think that we can have the economic muscle to withstand the test of time? And do you think the stimulus package, which is set to be injected into the economy by the government, will be enough to cushion Kenyans during that time of the lockdown that you support or are calling for?
I believe we have the capacity. The reason is why I'm saying so. Earlier on, remember I said that before the corona outbreak, there were scheduled trips, foreign trips, to other countries in the name of benchmarking, the MCAs, the MPs, and so on. Where is that budgetary allocation going to? Do we need benchmarking right now? Do we need foreign trips right now? We do not need them. What is important is let's save lives. These foreign trips are not very important at the moment. Redirect the money to actually bring down these new infections. And this can only be handled by the government rechanneling the money to healthcare at the moment, or allocating the same budget to Kenyans. We can supply Kenyans with food for the remaining time, maybe let's say 2 weeks, 14 days, as lockdown, to bring down the infection.
Therefore, your clarion call is that you support a lockdown.
Correct.
But it must come with an economic package.
Precisely.
All right, let me go to your colleague, Ann Sakwa. Good afternoon. Thank you for joining us on the program. What's your take on this? Do you support a lockdown?
Yeah, I actually support the lockdown because currently the curfew is not helping anything. All over town, all over everywhere, people are gathered, there's no social distancing. Kenyans are not ready to embrace the social distancing that the government is putting. And actually the curfew, according to me, it has no impact because the positive cases are actually increasing daily. So the curfew is meant to put people in the house early. And if you put people in the house early, what they do normally in low-class areas, you find people in their balcons all over, no social distancing. So this curfew has not made any impact. It has only made an impact of nobody is in town after 6. Because actually it is giving no feedback to the health sector that positives are being reduced. In a where we live, there is no social distancing. So the better way the government will control this thing is actually a lockdown, and a serious lockdown, but with an economic backup, that is people will be catered for.
Correct.
Because actually, our country has the capability of doing so. Only that they want to go far away around this thing, yet people are becoming more infected daily. And when we continue with this, we see numbers increasing daily. So I support a lockdown because this thing is not helping Kenyans.
Okay. Let me come to Claudia then.
Yes.
We are, of course, cautious of the fact that there must be an accompanying package of an economic stimulus out of the crisis in the event we all call for a lockdown or the government imposes that. But the point is, again, the concerns equally that are raised by the healthcare professionals in the country as regards, of course, the continuing cases of the coronavirus that crops up in our hospital centers in the country. A survey done, of course, by the by a health body has shown that, for instance, if we are to talk about the nurses in the country working in ICU per shift were 81 in all hospitals across the country in the selected 21 facilities. And the aspect which is of more concerning here is the percentage with which the ICU trained nurses are in regard to other nurses. Kenyatta National Hospital, 93.8. The Moi Teaching Referral Hospital, 50%. Level 5 hospitals, 41.38%. Private hospitals, 23.79%. Mission hospitals, 21.28%. Even in the midst of that lockdown that we are all supporting, how do we then wrap in immunity our healthcare professionals who are at the forefront of all this?
That is something I think I said once. It's not a matter of just having those few people. By us getting to have each and every healthcare facility and each and every healthcare person who is in any facility, regardless of the ones that are being in charge of the COVID or even the other normal persons, as long as we get to train them on the best way on how to curb this person, from the time it's a suspected person to the time it's confirmed. That is the best way we can protect us as healthcare personnel. And this person, as long as he knows or she knows, this is what I'm supposed to do. When I receive this person, until confirmed, it does not mean, since it's a suspected, I can now decide not to put on my mask because it's a suspected. That suspected can be a positive person. So we need to be very protected from the word go when you receive each and every patient right now. How you are going to go about it, that full training is what is needed. We trained 1,200 people,
okay,
but that is not sufficient. All these people who are still in the healthcare need to be trained. Correct. We can use those 1,200 people to train. They can become the TOTs, training of trainees. Correct. Train each people so that any person who enters into that health facility is able to curb and able to know the right steps and the proper way to sort this person out from the time the patient comes in to the time the patient leaves, whether it's a positive or a negative. Remember, we have people who are carriers. I can be a carrier. A carrier will never have any symptoms. 0% symptom. I'll be walking around. But as long as I've come there and I've told you, hey, I've had contact with this, I've had this and that, do not just say, no, go home and quarantine yourself for 14 days. We are Kenyans. I will not do that because I know I am not there, but I am the carrier. I am working with it, giving people. So we need not to put anything at chance. Any person who we say this one is a suspected, let's ensure we do the full test.
Okay. Secretary General.
Yes, sir.
The current exponential growth of the number of cases of the coronavirus pandemic is overwhelming our healthcare capacity in the country.
Correct.
You support a lockdown, so is Claudette, and of course, Anne here on the program. But the point is that it equates, or it is equivalent to staying a total stay home.
Yes.
Will that save lives? Will that save lives? And will that perhaps take the burden off our healthcare system in reducing the number of positive cases in the country for the healthcare infrastructure and workers to respond adequately to the already confirmed number of cases in the country?
I believe yes, but with the conditions. Like I said earlier on, or what we address on the presser is put into consideration. We have to increase the number of healthcare workers before we go into the lockdown. That is the condition.
A condition?
Yes.
Besides the economy?
Correct. Even if it means voluntary, it has to be increased. The government has just to find a way. Because you cannot go to a war minus the soldiers with you. You have to evaluate at the number of the level of contingent that you have before you go to the war. You cannot have understaffed army and then go take your soldiers into a war. It's not possible. So the issue here, the soldiers here are healthcare workers. We have to increase the number before we go into this war, whether we like it or not.
And are we getting the strategy right here in regards to the response so far the government has offered? with regards to, of course, the concerns, notwithstanding, raised by healthcare professionals in the country in regard to the absence of essential drugs in the country and across healthcare infrastructure across the country, and more concern in the lower ICU bed capacity in the country.
Okay, I understand the research in this country where you find we don't have enough health, enough facilities to handle this in case it is serious, in case it turns to chronic. But now, what the government is not doing, actually, when you talk about, for example, I said the curfew. First, let me say that the people who are told to handle the curfew are the policemen. They don't know anything about infection prevention control. Number one.
They
don't know
themselves
anything.
were at risk.
They themselves are at risk. You find, like yesterday, they arrested some people above that time, and they were all put in one lorry. Number one, there is nothing like they have been taught about infection prevention control. The government has not done that. Now, we find that the ICU beds and the ventilators in this country are very few. The nebulizers, they are not, they are not enough. But the government is doing nothing on procuring more. The government, as long as they are employing more health workers, they should be ready to provide those machines to use and PPEs for us to use them. If you look at that client, every client now should be a suspected positive unless confirmed negative. Every person now is a suspect unless confirmed negative. So the government should actually have a good strategy of first making sure that there are enough equipments, enough ICU beds, because even if the schools are being put, that this school has 100 beds, we will use it for quarantine. There is no nebulizer there. What will you use to handle this patient if in case the hospitals are overwhelmed?
Okay, good points. Then, Claudette, if I may come to you then. Talking of that lockdown, it means there will be no travel. It means there will be restrictions. Life will be on hold. There will be some elements of life that we never thought will be policed that will be policed. It will be unusual and everything will be paused. But this is my question. Will it then lessen the number of cases at the counties and perhaps Nairobi being the epicenter, which is the hotbed, sort of, to use that term at the moment because of the confirmed number of cases, will it lessen the cases across our counties in this particular regard and have Nairobi under grip and control the cases already confirmed by the government?
100% opinion, I think it will be of help because right now you're seeing many people trying to travel back up country so that they can be with their family and all that. But as we're saying, Nairobi is the epicenter. We are not sure who is carrying the COVID, who is not carrying. So when you put the total lockdown, that means you're going to control it within us who are in Nairobi. The ones in other counties, the moment they get that suspected, if someone has traveled, there's something that my mom always says, if you've traveled and you know there's that COVID, check yourself at the hospital first. Let them check you. Ensure you've quarantined yourself. For me, any person who tells me they're traveling up country, I tell them, ensure you have your 14 days quarantine before you start anything else. So if we keep up with that, we are able to control. With Nairobi being the epicenter, having things in control during the lockdown, not just having people just staying in the house. We can have health workers walking around.
Essential service providers.
Yes, checking at people, knowing, hey, there's this lockdown. If they come and see, like, let's choose Umoja. We found many people with high fevers. We need to concentrate at Umoja. There might be something happening there. We are able to control that now. But with constant movement, we will never be able to control it at all.
What about the cost here in regards to the quarantine? You say that the government will not, or it's the case of the mandatory quarantine as the government has outlined. What's the cost then? I mean, because again, you have to dig into your pocket.
Now, that is something now I think the government needs to have a proper plan. Because now when you're putting someone on lockdown, that means this person will not be able to work, will not be able to earn. So what we as the government are able to do, we can say we can supply food up to this time. We can waive a rent for the houses so that people can be able to sit and control. Because at the end of the day, look at the bigger picture. If we say these things are not being done, we'll end up having more cases, more deaths, of which that is something we do not want to reach. We do not want to reach that state of Italy where everyone is crying and you're not able to see your person. But if we have this lockdown and control it, within a month or two, it's all back. We reduce the numbers even up to 0. Then we can go back to normal life.
It's a case of perhaps having a normalcy or a calm situation in the aftermath or in the foreseeable future.
Yes.
SG Wanyonyi.
Yes.
Then there's the point. We'll come to the aspect of now the other infectious diseases equally, which are important, but are not getting the adequate attention because of the current status and the government's effort to fight the pandemic. Given the state of affairs at the moment, talking of a lockdown, which is our subject, our meal of discussion here, the governor, Uasin Gishu County, and generally North Rift governors have said that you will not come into our county. And if you do that, you have to self-quarantine themselves.
Yes.
The other directive they issued was that the elderly people who are above 65 years cannot leave their homes because you are vulnerable and you are soft spot target for the coronavirus pandemic. Is that enough perhaps before a lockdown for measures that can contain the coronavirus pandemic across our counties?
I totally support what Governor Mandago has done. Look here, I listened to C.S. Kagwe the other day, and he was saying these areas that are hotspots for coronavirus, for example, Nairobi, Kilifi, Kwale, if the government can think of a lockdown in Nairobi, lock Nairobi, no one should travel to other counties. Let's manage Nairobi.
In and out of Nairobi.
Yes, in and out of Nairobi. Let's manage Nairobi. Let's gap this thing from Nairobi and do the random testing. Yeah? Put the MLOs, the medical laboratory officers in this county, let them do random testing. Even these slums, do the testing within the county of Nairobi. No one is going out, no one is coming in. This thing will be killed within 2 weeks. I'm quite sure of that.
Okay.
Considering the economy, now that it's difficult to put the whole country into a lockdown, we can lock down the few hotspots of Kenya. Nairobi, County, Kilifi, put them under quarantine. Lock them, then do the random testing. We identify the positives, isolate them. Then from there, we can manage. The other counties will not be exposed. That is exactly what I can say.
All right. As we finish
like what Mandago has said, you are traveling from Mombasa, you are traveling from Wajir, you are coming to my county. You reach in my county, you have to quarantine yourself. Very key, because we don't know about you.
Yes, and Sako, as we finish up, even as it appears that there should be the element of, you talked about earlier about the police brutality, the curfew, and them themselves, of course, who are exposed because of not taking precautionary measures, and that all these things should be about 90% persuasion, 10% enforcement. Given that, and couple it up with this, are we turning a blind eye or appear to be forgetting about the other diseases that are deadly in the country, for instance, cancer? And is this perhaps taking the attention away from people who are equally sick in some other aspects and capacities, even as we battle the coronavirus pandemic?
Yeah, sure. Actually, the truth is the whole other diseases are forgotten. And what we are measuring on coronavirus, we are not doing it to a point where we are protecting those who are already sick. There are people who are asthmatic, there are people who are they are seroreactive, there are people who have their own diseases, diabetic, hypertension. But they are all forgotten, and the measures that they are being put are even not protecting those people who are now sick. They are not even being protected because the measures that the government has put, so far they are not protected. That is why, to some extent, I will also support Mandago, because those people who are over 75 years in our rural areas may be having hypertension, but the measures that we are having now of a curfew at after 7 are not even protecting them. And you see, these people and these patients are already forgotten. And mind you, I always say, protect me, I protect you. If this thing takes our country to a point where we are having so many cases and so many deaths, the economy will automatically come down, and it will take a lot of time for the country to recover. Actually, the main point is, it is good, and according to my thinking, the government should consider a few days of suffering, but the country is being saved. Correct. Because however much these disease get rampant, even to them they will have the disease. They are not exempted of this thing.
Okay.
Yeah.
And they're not immune either, because we are all vulnerable. Claudette, as we finish up, one last question here. And Nicola, I'd like the SG to respond to this particular question. It's about the 6-year-old boy who had a travel history from India, and perhaps might have affected at least 6 nurses who attended to him, but the parents never informed the hospital or the concerned department about that. Of course, they said it's going to be a legal suit that they will pursue. Isn't it also the responsibility of the members of the public and parents, to be specific here, that they should take up the responsibility? And why do you think in this particular regard that they have fallen short of that?
Yes, I do agree. It is necessary for any parent to take responsibility. Kids, I think it was unfortunate to lose that kid in the first place because he had underlying ailments that made COVID to succumb. Knowing by fact that you have a kid who is a COVID positive, the rate of death for kids is low, but the rate of them spreading to other people is high, because this kid will play with every person that will come across, will touch each and every person that will come across. So you as a parent, me as a parent, if I know I have a kid who is COVID positive, let us ensure this kid is well quarantined. Let us reach out to the health cares so that they can be able to take care of this child if you feel you are not able to manage the child. That way we can be able to also minimize that spread, because the high number of spread is coming from the children. We play with them. If I see a kid here right now, I'll want to hold, to play with, to joke with, and they play with other kids. So it will move from one kid to the other. This kid will go to their house, spread to the family. So that from the perspective of those parents, what they did was not right at all.
Okay. Do you support the legal steps that they will be taking against the parents?
At this point in time, I actually don't think it's the best way to go about it, because we still need to fight. We need to look at the bigger picture. Here, the bigger picture is how can we resolve these issues. So when we start saying now we want to fight, we will not be able to resolve the main issue here.
Okay.
Yeah.
Which is at our point of attention. Yes, as we finish up, yes, SG.
Yes.
Please, your final remarks.
Yeah. My final remarks, like I said, our key interest here is increasing the level of health workers, the soldiers. I'm still fighting for the soldiers to be increased. In this case, diagnosis is key. WHO, through their director, has said that if we have to win this war on COVID-19, is that we have to intensify laboratory diagnosis, identifying the real patients, isolating them, and doing the management. And the key issue here is that we have to increase the level of medical laboratory officers to do the diagnosis. Like I've said, we can isolate or some of the areas that are hotspots like Nairobi, Kilifi, and Mombasa. Lock down them, then do what? The random testing. This random testing will only be done by people who are designated legally to do the testing, which are medical laboratory officers. That is my point. Looking at the economic impact, doing a lockdown maybe for the whole country will be very expensive, will have a drastic effect on the economy. We can do a partial lockdown on the hotspots and then manage the other areas. That is what I can say.
Yes, I'll give, for purposes of fairness, and to finish up briefly.
Okay, my final remarks, before I do my remarks, I wish to say that to sue that family, I do not support. Because where did they pass through? I think they passed through the airport.
International Airport.
Why didn't they do that before it comes to the hospital? So the people to be sued, JKIA, where were they really? Because for sure, where did this child pass through? They passed through the Chomogi, who finished up and cleared them. That person is the one to be sued, not them. Because to some extent, coronavirus is creating stigma, more than HIV, more than cancer. So it is now creating stigmatization. People will view you like you are already coronavirus positive. But whatever he passed through until he reaches to the hospital, those people should be sued. Lastly, the health workers and actually the diagnostic scientists who are the laboratory technologists should be increased in this country and be valued. And I have one motto: don't look at coronavirus to make yourself rich. Look at this coronavirus to protect me, I protect you.
All right. And Sakwa and Claudette Alusa and the Secretary General Enock Wanyonyi, I appreciate your time. Asante sana.
Before you finish, just give me 1 minute.
Briefly.
Briefly. It's only in Kenya that we've never identified the value of laboratory officers. Elsewhere, for example, in the US, laboratory department is put under Ministry of Defense. Why? These are biological soldiers. These are soldiers who handle biological weapons. COVID-19 is actually a biological weapon. Same to Ebola and so on. You find a mad person, will release this virus, and it will finish all of us. Today, it is very clear that US is still investigating chances of somebody from the laboratory who released this virus in China. So it is very important at the moment that Kenya needs to take very crucial importance on the laboratory as a department.
Asante sana, SG Enock Wanyonyi, Claudette Alusa, and Ansakwa. I appreciate your time, members of the Kenya National Medical Laboratory Officers in the country. So we take a look at the numbers so far we have on our screens in regard to the tracking down by Johns Hopkins University with regards to the coronavirus pandemic. The total confirmed number of cases, 1,277,962. The total confirmed number of deaths, 69,555. And countries or regions affected, 183. So far, this is what we have. So we take a look at the recovered number of cases, 264,439. About an hour ago, this was 263,000, meaning that there is light at the end of the tunnel, the hope on the horizon in regard to the continuing coverage, cases of recovery in the world. The total confirmed number of deaths, 69,555. 1,277,962 is the total confirmed number of cases. Of that, America has the lion's share with 337,646, followed by Spain, 131,000, Italy, 128,000, Germany, 100,000, France, 93,000. All are 4 European countries, which is at the epicenter of the coronavirus pandemic in the world. So when we come back here, we take a look at the global outlook in terms of the geography with regards to tracking down by the Johns Hopkins University. Now, the attention is now away from the city of Wuhan in Hubei province, and when you move towards the United States of America, look at the heat map and how it is across the across almost 50 states of the United States of America. It's the point of concern, and more worryingly is the red shaded area here, which is in New York, and the city that never sleeps is apparently sleeping in regard to the Donald Trump administration and how it continues to misjudge the situation despite the calls raised by the governor in regard to wanting more effort and support from the federal government in Washington, D.C., which is towards this end, but appears to be not as much affected as is the case with California, North Dakota, South Dakota, Carolina, Massachusetts, and equally in Boston and in the United States of America. So you come down, you have the Latin American part of the world. Here is, of course, where you will find the likes of Brazil, Paraguay, Uruguay, Chile, and Venezuela, where there is the much hit here in regard to the confirmed number of cases in Brazil and how the president Jair Bolsonaro has misjudged the situation. More or less the Trump of the tropical in southern part of the continent. So you come back home to the African continent and you have Kenya here, where there are active cases. In Egypt, we have equal cases. You have the western part of the continent, Senegal, Mauritius, and in Nigeria, Cameroon, Togo, and equally in the Lake Basin region here, the Central African Republic, the Democratic Republic of the Congo, Rwanda, Burundi, Uganda, and then come down to South Africa, which has the highest number of cases in the continent. And when you go to the Middle Eastern part of the continent, you have Iran, which is the most affected country in the center part of the world. Equally, there are cases in Saudi Arabia, equally cases in Israel, the Palestine, and cases along Qatar, the United Arab Emirates, Saudi Arabia, Kuwait, and Oman. So you come to the European continent, and here is where we have Italy, the most affected country, This is the big red shed area and one of the most affected countries in the world, the second after the United States of America. Now China appears to be off the radar of the Global World Health Organization. So we take a look at this as we finish up. This is the timeline, and it's covering 22nd of January until the 1st of April, about 5 days ago. So when I play, it's going to be a total change. So once I play there, so you have the cases and how this graph is going to change instantaneously. So we have these numbers that are playing out. So by the end of the 1st of April, these cases will be about 1 million. We are now 5th of February, 6th, 7th, 8th, 9th, 10th, 11, 12, 13. We are still in February. And these cases that are counting down beneath the deaths that are playing will be numbering up to 1 million. So we are still at 120,000. So look at how it's playing out. You can see how the numbers continue to interchange. China was top then until Italy, the United States, Spain, Germany will overtake China. Now China is position 3 by end of March. Then you can see by 1st of April, we have these cases, 1,249,107. So China is position 6 after America, Spain, Italy, Germany, France. And you can see how the tracking is done by the BBC. This is, of course, they sourced out the Johns Hopkins University. And we are doing that for you to get timely update of the coronavirus crisis and pandemic in the country, even as the government continues to struggle desperately against time to come up with measures to combat or battle the coronavirus pandemic in the country. And thank you for joining us here on the broadcast this morning. I am Ayub Abdikadir Abdi. The number has been 07914789990. The hashtag on Twitter is NewDayKE. We'll see you tomorrow at the same time by the grace of God. Stay home, save lives, and let's not overburden our healthcare system in the country. Good afternoon.